Hello and good evening to all of you. So let's begin the new module today, Urogynaecology. So as you can see in the picture, you can get the station on all types of urinary incontinence, stress, urge, overflow incontinence, and there was a station on sensory urgency also. That was a structure discussion task. Then there is urethral diverticulum. So that when the station came for the first time, there was confusion whether it is cystocele or urethrocoele. But the patient was giving typical history, the 3 Ds you have to remember in urethral diverticulum. That is dysuria, dyspareunia, post-void dribbling. And the important diaries here will be the bladder diary and the food diary. Like in gynecology, we know it's going to be the menstrual diary, and in the PMS, symptom diary. So these are the small points which you have to keep in mind. And also, there will be stations on the pelvic organ prolapse. The teaching stations related to the urogyne, which are the important ones, they include the urodynamic studies and the pelvic organ prolapse quantification. All right, so let's start with our class today. Who would like to present first? From candidates from India. Otherwise, it gets very late, isn't it? Okay. Anita or Shweta? Anyone?
Yes, I can do.
Okay, so first Shweta, then Anita. That's absolutely fine. Okay, come please. Take your station. 2 slides. Take your 2 minutes.
Yeah, next slide, please.
Mhm.
Yeah, previous one, please.
Yes.
Can I start?
Sure. If you're ready, start, please.
Yes, yes. Hello, I'm Dr. Sweta, one of your doctor in Urogynae clinic today. Am I talking to Mrs. Kate Reagan, 58 years old?
Yes.
How can I call you?
Call me Mrs. Kate.
Mrs. Kate, I understand that you are here because you have some bulge down below. And is it so?
Oh, yes.
Uh-huh. So, Kate, before proceeding further, as I am meeting you first time, may I ask a few questions to know more about you?
Yes.
May I know about your problem in your own words?
Yes, actually, I'm having this bulge down below in my front passage for the last 4
Mhm.
months, and it is
Mhm.
causing me some discomfort.
Okay. So have you noticed anything that increases or reduces it?
Yes, sometimes if I'm lifting heavy weights, I can see the bulge increasing.
Okay. So are you able to reduce it completely?
Mm, no,
Okay. Any pain in back or tummy?
no,
Any problem in your water work?
no,
Okay. So anytime you need to rush to the loo or leak while leak on coughing?
no,
Any problem in opening up of your bowel?
no,
So, And so I can see that the womb removal has been done 6 months back. May I know about that in your own word?
Oh, yes. Actually, I was having some bleeding. I am already menopausal, but there
Mm-hmm.
was some bleeding, and then my doctor, she told me that it's better to get the womb removed. So that womb was removed about 6 months ago.
Mm-hmm. And how did you recover after that?
Yeah, recovery was fine.
And when did you notice this bulge? I can see that since 4 months. Is it
Yes.
so?
Yes, yes.
Okay. And may I know about your previous deliveries?
Oh, yes, I have three children. They were all born vaginally and
Mhm.
no problem at all.
Any difficult childbirth?
Maybe in the last delivery, I remember the instrument forceps was used.
Okay. So, and how was the recovery after that? Any bowel
No,
problem or
no,
urine problem after that?
no. No.
So, so what do you do for living, Kate?
I'm a university professor.
Does it involve prolonged standing?
Yes, because I have to talk
Okay.
long classes. I have to give long lectures, the presentations.
hmm So, Kate, do you have any medical illness like asthma, cough?
I have cough and I'm taking treatment for that.
Okay, and is it controlled?
Yes, it's better now.
Okay, so when did you last visit your doctor for that?
Yes, I actually now I'm visiting my GP, so it was last month I met him.
Okay, so any surgery done in the past other than that womb removal?
No,
Do you smoke?
no,
Okay, and drink alcohol?
occasionally.
Okay, so some of my questions are personal and intrusive, but I need that. May I go ahead with that?
Yes.
Are you with someone now?
No, not at the moment.
Okay, so do you have any future plan for sexual intercourse, or you want to be with someone later on?
Maybe, yeah, yes.
Okay, so do you feel dry down there?
What do you feel? What?
Dryness over
Uh-huh.
there.
Yes, yes, sometimes.
Okay, so and how is the support at home, kid?
Well, my daughters are there, so I'm staying with them.
Okay, so how is the mood these days? Like feeling low down?
Uh, well, I'm okay.
So, Kate, I can see that your height weight ratio is 30, which is high. So, have you ever thought of reducing that?
Oh, yes, actually, GP has enrolled me in some exercise program, but I'm
Mhm.
finding it very difficult to lose weight.
Okay, so I can see that it happens, Kate. Actually, losing weight is difficult, but I'll connect you to the some dietitian and exercise specialist with that. So
Mm-hmm.
I'll come to that in detail later on. So, Kate, do you want to add on any information?
No, actually, I want something definitive treatment for this manage for my bulge.
Yes, yes, Kate, I understand, and will support you in your decision. So let me explain all the management first, and then whatever you choose will support you. Okay.
Mm-hmm.
So
Yes.
I have been provided with your examination finding, and next slide, please.
Yes. 1 minute. Yeah.
I have confirmed your name, age, and chest number. It belongs to you. It says that you have vault prolapse stage 2. Are you aware of that?
No, what does it mean?
Yeah, Kate, actually, it's vault means the top of vagina, and prolapse means it has come down from its position. So usually, what happens that in vault prolapse, top of vagina comes down. Normally, what happens that all the organs inside the pelvis are well supported with the muscles and ligament our body, and whenever these support are lost, like there is weakening, stretching, or any like loss of hormone, like we ages, like in menopause. So all these are contributory factor to weaken the muscles of and ligaments of pelvis.
Hmm.
So due to these cause, sometimes the top of vagina that could have been due to that it has come down, and it is called vault prolapse. So am I clear so far?
Yes, okay.
So, so this is stage up to stage 2, and regarding the management of this prolapse, as I can see that you are keen for definitive treatment, but let me tell you that all the first of all, we start with the lifestyle modification and then simple measures. Then this doesn't work, then we'll go later on up to the surgical management. So, may I go ahead with that?
All right. So, yeah, you can tell me.
Okay, so usually your care would be under a team of specialists like my consultant gynae, urogynecologist, and the specialist incontinence specialist nurse, and the physiotherapist, dietitian, all would be involved in your care. And first of all, we advise the lifestyle modification, as like I can see that your height weight ratio is high. So uh, take care of your diet, do exercise, reduces weight, because if weight is not reduced, then it can aggravate this prolapse, as well as if any definitive treatment is done, then that will affect that also. Okay, and there are chances
Mhm.
that prolapse can come back after that treatment also. So
Mm.
lifestyle modification is very important. Do yoga, exercise, and just take healthy diet. And after that, for as you told me that some dryness is there, we'll give you some estrogen ointment for that. Okay.
Yes.
And there are some, as you have been doing the pelvic floor muscle exercise, so may I know that it is supervised or not?
Oh, yes, it
Means
is.
by someone?
Yes, yes, the physiotherapist is there, but it is not improving my condition.
Okay. How long did you take that?
I think it is more than 4 months now.
Okay. So as this is not improving, but let me tell you that continue. You can continue with that because that improves the strength of pelvic wall. Okay.
Right.
So there are another treatment of, we call it pessary, which can be inserted inside vagina to support the vault.
Yes,
So
yes,
to
my
give support.
GP, yeah, my GP told me about that, but I don't want anything
Mhm.
inside my vagina.
May I know?
Yeah,
May I know why?
yeah, that it will cause discomfort. Can you tell me about the surgery?
Yes, I'll come to that. There are two type of surgery for that. One is through the tummy, called it sacrocolpopexy, and one is through the vagina. We call it sacrospinous fixation. And both surgery are has each advantage and disadvantages. And there are one more surgery. We call it the colpoclasis, but this is for very old lady, not for you. So regarding the first surgery, colpo. The sacrocolpopexy, it is done after the team of involvement, we call it MDT. And before that, they advise some test, and after that they do the surgery. Surgery is done through the small cut is given to the tummy. It can be done uh, after putting you to sleep or numbing the waist down below, and it is a small cut can is given over the bikini line, and the top of vagina is attached to the base of backbone called sacrum, and it is attached to that, so that it would be in that position only. So benefit is that the length of vagina is maintained, there is less pain during sex, and also there is less chance of having the water leak later on. And also the another surgery is called sacrospinous fixation. It is done through the vaginal route, and it is less invasive than first one. And it is the top of vagina is attached to the one of the ligament on the lateral pelvic wall. And this is like a smaller surgery, less hospital admission is required. And but both are surgeries, so there are risk of anesthesia, risk of bleeding, infection, injury to other organ are there. And
Mm.
but let me tell you that even with all the surgery, there might be possibilities that the urine leak can happen even after that. Okay.
Mm-hmm. Okay.
And the okay, so with the side effect of sacrospinous fixation, which is done through the down below, is that the length of vagina is narrowed, and there are chances that prolapse can happen again.
Okay, time is up.
Okay.
So I have one question. So
Yes.
which one will be better for me? Which surgery?
Actually, for your case, as you are young, so the abdominal route would be better because it increases the length of vagina, and that is more satisfactory than more success has are with the abdominal one.
Mm-hmm.
Okay.
Okay.
So right now I'm giving you patient information leaflet for that. Go through that. Just decide and let us know. I'm speaking with my consultant and writing back to GP about that. Okay. And if you
Yes.
allow, I am referring you to the concerning specialist regarding that.
Okay. Thank you. Well done. Information gathering, history taking part was absolutely fine.
But surgery
Communication
part, I think,
was
little.
okay. Surgery part is little difficult to explain in post-hysterectomy wall prolapse, I know. And it is a bit lengthy, it takes time. That is why I wanted to cut you short. I didn't want to listen about the pessary because otherwise you will waste another 1 minute in that. So
So
at least,
initially, I asked that, do you want to explain me about the lifestyle and conservative? Then
yes, yes. So one is the lifestyle, so you can go on with that. And weight reduction, smoking, all those things, exercise, fine. But pessary, I didn't want because the way
okay.
you asked was absolutely fine. And even in the very beginning, the role player can say, no, the GP has told me about all this, and but I'm fed up and I just want to. Can you tell me more about the surgery first? It means that there is marks in the surgery, so you can talk about the surgery first.
Okay.
Then you can say that while waiting for the surgery, try to lose weight. Then you can start with lifestyle modification because she will get appointment for the surgery after 6 months. Sometimes it takes even 1 year in the NHS. Right. Okay. Good one otherwise. And you somewhere you said that you were still young for abdominal root
Yeah,
surgery.
yes.
That's a
Sorry.
slip of the tongue. I know. I know.
Yes, yes,
Yes.
because
Yes.
he's 58. I
Yeah.
thought, yeah, 48. Yes,
That if
okay.
you will be sexually active later on,
Yes.
so tummy root will be better than the
Mm.
vaginal root because there will be like no vaginal shortening and no dyspareunia, no pain during
Yes,
sex.
yeah,
All
that
right.
was interesting.
Yes. Okay. So you're in Urogyne clinic. Hello, I'm Dr. Shweta, one of the doctors in the Urogynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Mrs. Kate. I understand that you have been referred by your GP because you're having a bulge down below. Am I right? So if she says in the beginning it's bothering me too much, I'm really sorry to hear about that. Is there any other concern and expectations from the meeting today? So in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions? And I may need to examine you and then discuss the plan of management. Will that be okay? I shall also give the written information leaflet about your condition and write back to the GP about our mutually agreed care plan. So can you tell me more about your condition? And may I know why the womb was removed? And how was your recovery after that? I'm sorry to hear about that. It must be difficult for you. Do you have any other complaints like back pain, tummy pain, vaginal discharge, any bleeding? How about your waterworks and the bowel opening? Few other questions, yes, you can ask. Do you have to rush to go to the toilet or do you leak urine? Just to exclude uh, incontinence. Okay. And is it affecting your quality of life? And how are you coping? I'm sorry to hear about that. And are you updated with your cervical screening? And did you ask the cervical screening? I think no. Previous cervical screenings, we are going
No,
to.
I thought hysterectomy has been done. That's why I left
Yes,
that.
yes. Yeah. Previous screenings. Yes. Okay. And would like to sexual history. Yes, always signpost. I would like to ask you some personal questions. Are you with someone now and are you sexually active? If she says partner has passed away, so yes, you have to be empathetic. You're not going to say, okay, like sometimes it comes from the mouth. Okay, I'm sorry to hear about that. Please accept my deepest condolences. Have you ever been pregnant before? Can you tell me more about your previous pregnancy and delivery? Any difficult labor, delivery with instrument? How was recovery? Are you following GP for any medical condition? Okay, so I'm having cough. Are you taking any treatment for that? How is it now? Has it improved? And did you take any hormone replacement therapy and any allergy? Any surgery, any other surgery on your tummy or down below? And may I know what do you do for living? So, occupational history, she's going to tell you something in these Urogynae stations, like housekeeping, and she's lifting heavy weights, or like very nicely you asked that if the lady is a professor, then we know she will be studying a lot of for the for her classes and all. So this can also lead to increase in the bulge down below. So any support, how about the support at home? May I know, do you smoke cigarettes? Okay, and drink alcohol? How have you been feeling lately? I can see that your weight height ratio is 30. Are you aware of that? Are you trying to lose weight? Okay, if she's trying to lose weight, I appreciate her. Thanks for these informations. Would you like to add anything important? So here actually already the examination finding is given. So you don't have to tell a lot about the examination. In face to face, you can just say, I would like to examine you with your permission and in the presence of chaperone just to assess your general health. I have your examination findings and I have confirmed the name, date of birth, and NHS number. And from the history and examination findings, most likely you're having a condition which is known as vault prolapse in medical terms. Have you heard about it? The vault is the top of vagina, and this condition means the top of vagina has come down and it has come down after your surgery. So, what could be the cause? This can occur because of weakening of supporting structures like muscles and ligaments, which keep the vault in its place. Weakening can occur during pregnancy, delivery, and particularly if the labor was long or difficult, or if instruments were used. And weakening can also occur with aging in women after menopause. Am I clear so far? Any questions? So, regarding the management, we have simple measures like lifestyle modifications, dietary changes, and we can offer the exercises. And I can see you're already doing the exercise and pessary. And if these simple measures don't work, then we offer surgery as a last resort. So, do you have any preferences? Is it okay if I discuss with you about all these treatment methods? If she says yes, okay, so you can start discussing because she might interrupt you somewhere in between. Because in the exam, it is never very smooth management. She's going to ask you something and she will interrupt you definitely. So I can see that you're doing the pelvic floor muscle exercise. May I know for how long? Is it under the supervision of a physiotherapist? If no, then we have to refer to the physiotherapist and they will teach you how to squeeze and contract your pelvic floor muscle. This will also help to strengthen the pelvic floor muscles and improve the bulge. Also, we can refer you to the dietitian. You can have healthy, balanced diet. And as I said that your weight height ratio is on the higher side. So weight reduction will also help in improving your condition, and you can also enroll in some exercise program. Avoid lifting heavy weights, standing for long hours, avoid strenuous exercise. And if she's a smoker, then of course you have to tell about the smoking and stop smoking NHS services. We also have a device which is inserted inside the vagina known as the pessary. No, I don't want anything inside my vagina. Doctor, can you tell me about the surgery? Then, okay, then you have to come to the surgery. Yes, we have two options and I will discuss their pros and cons. This will help you to make an informed choice. One is done through the tummy route, that is the keyhole surgery, or it is done by making a cut near the bikini line, and this is the major one. Other one is done through the vaginal route, that is from down below, and this is the minor one. Okay, then you can explain to her that the surgery which is done through the tummy route in this vault, that is top of vagina, is anchored and attached to the lower backbone, that is sacrum, to keep it in its place so that it doesn't come down. It has the advantages that there is less chance of bulge happening again, less chance of urine leak after the procedure. It doesn't interfere with sex, so sex is not painful. But the disadvantage is that it is a major surgery and you will be having longer hospital stay and delayed recovery. During the operation, there is risk of injury to internal structures like bowel, bladder, and blood vessel. Am I clear so far? Any questions? So regarding the other surgery, which is done through the vaginal route, In this, the part of the vault is anchored and attached to one of the ligaments in the pelvis to keep it in place. Advantages: it is a minor surgery. You will be having quicker recovery and shorter hospital stay. Disadvantages are there is risk of pain, infection, bleeding, buttock pain, pain during sex because it may shorten the length of vagina, and it is not appropriate if vaginal length is already shortened. All right, any questions? So which one is suitable for me? As you can see, that tummy procedure is a major one and vaginal procedure is minor one. So keeping in mind your age and your health, and if you get sexually active in the future, vaginal procedure may be less suitable for you, or you can say tummy procedure will be more suitable for you. So what are your thoughts about the surgery? All right, I will think about it. So while waiting for the surgery, and yes, here you can ask that, is it okay if I talk to you about the pessary? Because it will also help to improve your bulge while you're waiting for the surgery. If she's ready, okay, then you can talk about the surgery, pessary, just 2, 3 lines. I'll go back. So uh, um, this pessary is a device which is made of plastic or silicone, and it can be inserted inside the vagina. And you have to change and clean it at least every 2 weeks at regular intervals, because if kept for a long time, this can cause complications like bleeding, infection, or even formation of raw area. And also doing the exercise and following the simple, we will also advise you to continue with the exercise and follow the simple measures while waiting for the surgery. Any questions? No. Okay. Then tell her I will be discussing your case with my consultant and arrange another appointment in few weeks' time. Colpocolysis not needed. You will tell if she asks, because we know we are not going to do this because she will be sexually active and we do it in the very old fragile women. If she says that I know about a surgery in which the vaginal opening is completely closed, so will you do that for me as well? No, actually, yes, I appreciate your knowledge. There is a surgery in which vaginal opening is completely closed. This is offered to women who are not sexually active at all, who are very old and fragile, and they're not fit for surgery, and this is known as colpocolysis. Fine. They just wanted to, I mean, the idea of asking this question in the exam was that they just want to check your knowledge, that you are aware of all the surgeries. That's all. Thank you, Shweta. Good one, my dear. Okay, well done. Yes, Anita, come please.
Yes, ma'am. I'm here.
Yeah, take you 2 minutes.
Yeah. Yes, ma'am. I'm ready.
Yeah, one more slide. You can just have a look at it.
Mhm.
Okay,
Okay, ma'am.
start, please, if you're ready.
Yeah. Hello, I'm Dr. Anita, one of the doctor in the Urogynaecology clinic. May I confirm your name and age?
Yes, I'm Mrs. Anna Williams, 54-year-old.
So, how would you like me to call you?
You can call me Anna.
Okay. So, Anna, I can see the GP has referred you as you have certain concerns with your back passage as well as with waterworks, right?
Yes.
So, Anna, I'll be definitely discussing all about your concerns, and I'll also we'll talk about the investigation and management later on. I'll write back to your GP. And can I ask any other concern apart from this?
No, actually, this bulge in the back passage is bothering me a lot. So I just want some definitive treatment for that.
Yeah, definitely. Anna, can I ask you a few questions prior to that?
Yes.
So, can you tell me, is the since how long you are having this bulge?
Oh, yes, I think it is more than 6 months now.
Okay. Anything which reduces or increases it?
Well, when I have noticed when I have cough or I lift some heavy weights, there is increase in the bulge.
Okay, I see. And any kind of like abnormal discharge you can see from down below.
No,
Okay. How about your waterworks? As I can see, you have problem with the waterworks while leaking while cough, right?
oh yes,
While lifting weight.
Hmm.
So, do you have to rush to toilet?
No,
And any other time you leak apart from lifting weight?
no,
Okay. Any difficulty with initiating your waterwork?
no,
Or any time you have any problem with like after voiding, you have any kind of dribble?
no,
Any burning sensation while passing urine?
no,
Have you noticed any kind of blood in your urine?
no.
Okay. And what about what do you do, Anna?
I'm a housekeeping.
Okay. And what kind of work you have to carry for what?
Yes, I'm working in the school and I have to lift heavy weights. I have to lift the garbages and even the furnitures. So yes, and I'd have noticed that when I'm lifting the heavy weights also, there is some increase in the bulge.
Okay. And in such situation, definitely we'll get connected to your occupational workers, and we'll make it work out for you not to do this work. Okay.
Right.
Okay. And what about do you smoke?
I do, but I'm trying to quit smoking.
Okay. And smoking as such is not good for health in any ways, and it's in your condition it will be it will reduce the strength of the muscles more. Okay. So it's better to quit it. And I can also help you to get connected with the NHS Stop Smoking service if you allow me.
Okay.
Okay. And what about alcohol?
No, occasionally.
Any recreational drug?
No, no, never.
Okay. And how can you tell me more about your pregnancies and deliveries?
Well, yes, actually, I had vaginal deliveries, but in my last two children, it was very difficult delivery, and they were delivered with the help of forceps.
Did you have any kind of issues with the bowel or waterworks after that?
No, not really.
Okay. And how about like what about the support at home?
Yeah, my partner is very supportive.
Okay. I'm also aware, Anna, as I can see, your height weight ratio is around 37. So are you working out on it?
Well, it is very difficult for me to lose weight.
Uh,
Yes, but I'm not doing any exercise now.
I can see, and we'll get you connected to the exercise group specialist and also dietitian so that we can help you lose weight. Okay.
Mm-hmm.
And I can see you have been doing this pelvic floor muscle exercise for quite some time. May I know since how long?
Yes, I think it is 3 months now.
3 months, okay. And is it under supervision of somebody?
Yes, yes, the physiotherapist is there. Yeah.
Has it improved? Your condition has improved a little bit with this.
Well, my waterwork problem has improved a lot. I am not leaking urine anymore. But the bulge, no, there is no improvement in the bulge.
Thank you so much for the information, Anna. What I can see from your the picture which the GP has sent me is like I have seen the picture. What I can see is there is a bulge in the back passage, and also like you are being bothered by some leakage with the lifting of heavy weight. If you don't
Mhm.
mind, can I just examine you from down below in presence of a sapron?
Well, can you just explain with the picture because I know it causes a lot of discomfort. GP has
Any
already examined me, yes.
Okay, okay. That will be fine, but if you allow, I'll be very gentle and just to assess like any other leakage is there or not. Okay.
Oh, all right, okay.
Okay. So, and what I could see is like the generally what happens. This is a water bag, and this is the water pipe, and at the water pipe, the neck of the water bag is supported by some like muscles and ligaments at its normal place. Okay. and also the our pelvic structures, that is the womb, the water bag, and the back passage. All these structures are being supported by the muscle and supporting tissue, and they are lifted in a normal positions. But sometimes maybe some due to aging or due to some heavy works or any even sometimes weight may be a contributory factor, and other difficult deliveries, prolonged labors, this the muscle and strength of the muscles and the ligaments get weakened. Okay, and
Yes.
what happens is because of that, the angle between the water bag and the water pipe is straightened, and anytime whenever you do any heavy work, the water leaks. Okay,
Yes.
and similarly with the back passage, whenever the muscle supporting structures get weakened, any time the tummy pressure increases, then the water bags comes down,
Okay.
the back passage. Okay, so considering this, and as you told me, the the more problem you are having, you are more bothered with the back passage coming down, right?
Yes.
So what we can do, Anna, like uh, first of all, it's always better for us under the group of doctors like my consultant, the urologist also, and the physiotherapist, dietitians, and the exercise specialist. It's always better we can start with the lifestyle measures. Like as in your case, I can see your height weight is on the higher side. So this having this height weight on the higher side is also maybe one of the cause of the prolapse, and also sometimes the cause of leaking also. Okay, so we need to work out on that fast. Also, we need to stop smoking. And also certain other measures, like as you have already been practicing the pelvic floor exercise, I would advise you to continue it for 1 more month, so that and then we can again follow you up after 4 weeks to see how effective it is. Okay.
Yes.
Okay. And also Anna, we can offer you some pessaries. Pessaries are devices. They are made of either silicone or latex. Are you allergic to any particular like latex?
No, no.
Okay, so they are made up of latex or silicone, which we generally insert inside the vaginal wall to give support to the structures. Okay, and let me tell you, these pessaries would be helpful in both the condition, like your incontinence as well as in case of your back passage coming down.
Mm-hmm. So is there
And
any definitive treatment?
yeah, we do have definitive treatment in the form of surgeries, but before that, before doing the surgeries, we need to investigate you with some special study, which is known as the urodynamic study, to see the any other added incontinence you have or not. Okay.
Right. Yes.
So after the investigation is done, the surgery which involves is like tightening the supporting structures of the back passage. Okay, but
Mm-hmm.
I would like to generally what we do is like the muscles, the ligaments, and the supporting tissue at the back will be tightened up, and then we'll advise you to have avoid any kind of chronic cough, constipations, and also mm, any other heavy works, and then we'll follow you up after the surgery. But every surgery has its own risk of complication. Like this surgery may be done under by putting you into sleep, or it may be done by numbing you from waist down. So sometimes the surgery has complication of infection, sometimes bleeding, and also sometimes of the pus may come back again. Am I clear to you?
Okay. Yes.
Yeah. Any questions you have? Any more else?
No, no. The time is up. Okay.
Okay. So, I'll just write down back whatever we have discussed today. And as we'll meet you again after, if you allow, we'll meet you again after 4 weeks with the supervised physiotherapy and the lifestyle modification. And let's see how it helps you up. Okay.
All right. Yes. Okay. So good one also. You people are practicing, and that's very nice. So history and everything was very nice, and she also wanted to have definitive treatment. So I don't have to add anything. I think you say about the urodynamic studies?
Yes, ma'am. We won't do.
Um,
I got confused if
no,
we
no,
have to
no,
do or not.
no, no, no.
We have to do, no, ma'am, in this
In,
case.
no, 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 not in posterior organ prolapse, and it will be done in apical prolapse and anterior pelvic organ prolapse. The indications are that. I will share the screenshot. It is in the NICE guideline. And
Okay.
stress incontinence, if already diagnosed
Mhm.
clinically, no
Mhm.
urodynamics, not at all.
Okay.
Okay, so, all right. Okay, so let's discuss the answer. You are in which clinic? But let me see. You're already in the urogynec clinic. So then you said I will be involving the urologist. You're already the urologist sitting there under the super. I mean, then you can just say I will be informing my consultant about your case. Okay. If you were in the if you were in the gynecology clinic, then you can say that we will also be involving the urologist. So it is assumed that you're there in the urogyne. So involve your consultant only. My
Okay.
consultant. Yes.
Mhm.
Suppose in subfertility stations, if you're already in the subfertility clinic, then don't say I
Mhm.
will be involving the subfertility specialist. You will say I will be involving my consultant. If you're in the gynae clinic and you have to see a patient of subfertility, then you can say that we will refer you to the subfertility specialist. Okay, so just take care of that.
Mhm.
All right. So Anita, right. Hello, I'm Dr. Anita, one of the doctors in the Urogynae clinic today. May I confirm your name and age, please? How may I address you? Thank you, Anna. I understand you have been referred by your GP because you're having some concerns with your water work and back passage. Am I right? Is there any other concern and expectations from today's meeting? So in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions and I may need to examine you and then discuss the management plan? Is it okay? I should also be giving the written information leaflet about your condition and write back to the GP about our mutually agreed care plan. How does that sound? So, can you tell me more about your water work problem? So, either you can ask about the bulge first or the water work problem. Okay. Do you leak urine when you lift heavy weights? Do you have to rush to go to the toilet? Any burning sensation when you pass urine? And since when are you having this problem? Anything which makes it better or makes it worse? Is it affecting your quality of life? And have you taken any treatment for that? Okay. And I can see you're doing the pelvic floor muscle exercise. So, are you doing it under the supervision of a physiotherapist? Instead of asking supervision of anyone, use the term physiotherapist because they have specialist nurses who are there to supervise the pelvic floor muscle exercise or the physiotherapist. So instead of saying, are you doing it under the supervision of someone? Just complete the sentence, doing it under the supervision of a physiotherapist. Since when is it effective? Can you tell me more about the problem in your back passage? Do you feel the bulge? Do you have to push it before opening the bowel? Anything which improves it or worsens it? And she will tell you, she will be guiding you that the bulge is more bothersome. And she is feeling better, like with this exercise. The water work problem has improved a lot, and I'm no more leaking urine now. And just a few times I'm leaking urine, but the problem is with the bulge. So she's guiding you so that you can talk more about the rectocele. Any vaginal discharge or any vaginal bleeding. I can see that. May I know when was the last period? Okay. Did you take any hormone replacement therapy? Are you updated with the cervical screening? Did you ask the cervical screening?
I don't know.
No.
Mhm.
Don't miss in the gynae history cervical screening at least. Very, very important. Okay.
Uh-huh. Yes,
Yes.
ma'am.
And okay, signpost and sexual history. I would like to ask you some personal questions. Are you with someone now? Are you sexually active? Any problem during sex? Any leak during sex or any discomfort? And may I know, have you been pregnant before? Can you tell me more about your pregnancy and delivery? So she will talk about the difficult labor, instrumental delivery. How was your recovery after that? Any water work problem or the bowel problem after that? Okay. And are you following GP for any medical condition like cough, constipation? If yes, are you taking any treatment for that? Has the condition improved? Are you taking any other medication? And do you have any allergy? Any surgery on your tummy or down below? May I know, do you smoke cigarettes? Yes, I do. So smoking has no beneficial effect. Uh, and like it has no health benefits. And I would like to put you in touch with our NHS Stop Smoking services. Will that be okay? Do you drink alcohol? Okay, so occasionally, fine. Older ladies, you can skip recreational drugs. It doesn't make much difference. May I know what you do for a living? I'm a housekeeping. Okay, so what kind of work it involves? I have to lift heavy weights. So very nicely, you told about the occupational experts here that, okay, so I can see that you have to lift heavy weights and it will worsen your condition, worsen the bulge and the waterwork problem. And so we can seek help from the occupational therapist. We can involve them in your care and like so that they can discuss with you about your job because this is the job which she is doing and she's earning money, so we just can't tell her don't do it. That is why we have to involve the occupational experts. How about the partner and support at home? Have you been feeling low down? I can see your weight height ratio is 37. Are you aware of that? Are you trying to losing weight? If yes, appreciate her. If no, she is finding it very difficult. Yes, losing weight is difficult at times, and help is always available. And we can also put you in touch with the dietitian to have healthy balanced diet or enroll in the exercise program. Thanks for these informations. Would you like to add anything important? Is it okay if I examine you with your permission and in the presence of chaperone to assess your general condition? I would like to get a feel of tummy and assess you from down below. I will ask you to cough to assess the leak of urine and also examine the back passage to assess the lump. Is it okay? She was refusing examination. So yes, you will tell her. I will be very gentle. It will help me to give some if there is any new finding, like it will help me to assess any new finding as well. Will that be okay? If she refuses, okay, I respect your wishes. Yes, I have the picture here. And also from the informations which I have gathered and examination findings, you're having a problem with the water work known as stress urinary incontinence. And there is a bulge in your back passage known as rectocele in medical terms. Do you have an idea about these conditions? Okay, let me draw and explain to you. Or if the picture is there, you can just tell her that, see, these are the pelvic organs. In front is the bladder, the water bag, and womb, and this is the back passage. So regarding the waterwork problem, what happens that the water bag, it stores urine. There is an angle between water bag and water pipe, which prevents urine leak at all times. The angle is maintained by supporting structures like muscles and ligaments, and this angle gives way when supporting structures become weak. So whenever you lift heavy weights or do some exercise, there occurs increased pressure in tummy. This in turn increases the pressure in the water bag, and there is involuntary leak of urine. This is the stress in urinary incontinence. And all the pelvic organs are kept in place with the help of supporting structures. And when the structures become weak, the pelvic organs can bulge down from the normal position, like in your case, rectum, which is a part of your bowel, has come down, and this is known as rectocele in medical terms. Am I clear so far? So, so what could be the reason? That is because supporting structures are weakened during the pregnancy or childbirth, because of difficult labor, or if instruments were used, if the woman is smoking, if there's long-standing cough, or if you lift heavy weights. Okay. So regarding the management, we will be offering you the simple measures, lifestyle modifications. There is pessary, which can be inserted inside from down below, and surgery as a last resort if these simple measures don't improve your condition. So is it okay if I discuss them one by one? Okay, so as I have already discussed, for the weight height ratio, we can refer you to the dietitian. And like you can have healthy balanced diet. This will help in weight reduction. And smoking cessation will help you avoid lifting heavy weights, doing strenuous exercise, and standing for long hours. Continue your treatment for the constipation and cough. And as you're working as a housekeeping, so your occupation is quite demanding. So we are going to involve the occupational experts or occupational health officer. They might help you. And regarding the exercise, may I know for how long you have done? Okay, if she says 8 weeks or 12 weeks, so Okay, for the back passage bulge, it needs to be done for about 16 weeks under supervision of physiotherapist. Any questions? Also, there is a plastic device which can be inserted inside the vagina, which is known as the pessary, and it can be effective in case of involuntary leak of urine, but not so much effective in the back passage problem. If simple measures and exercise will not be effective in improving bulge, we can offer you surgery known as the posterior repair. So this surgery is done to strengthen the posterior vaginal wall. Some stitches are used to stitch the tissues together. This will provide support to the bulge and will keep it in its place. Done through the vagina and there is risk of pain, infection, bleeding. We will make sure that your bladder and bowel works normally after the procedure. Also, every effort will be made to ensure that sex is comfortable after the procedure. Any questions? All right, so I will be discussing your case with my consultant, arrange next appointment in few weeks' time, give you the support group number and contact numbers. So as of now, like when you're talking one by one, either you can say the MDT, that it's going to be shared care involving the dietitian, physiotherapist, counselors if she's too much upset, and consultant. Or either you can finish them one by one. That for the weight height ratio, dietitian is there. For pelvic floor muscle exercise, physiotherapist is there. And for her occupation, occupational health experts. So the boxes they will get ticked one by one. Communication with colleague is also patient safety. Okay, there was scenario in the May exam where the patient was quite young and she was insisting for the surgery and her family was not complete. So you're going to just counsel her, just remember the few lines that we offer surgery once the family is complete, because if you have vaginal delivery after the surgery, then again the pelvic muscle and the support will get weakened. Prolapse or bulge can come back again and you will need another surgery, and this might be difficult due to the presence of scar and may not be as successful as the first one. So we advise to delay the surgery until family is complete. If she's still insisting and she wants to have surgery before the family is complete, then tell her if you have surgery before your family is complete, then you will be advised to have cesarean birth, because with the vaginal birth, there is risk of the bulge coming back again due to the strain while pushing in labor. Okay. And regarding this station, some candidates told me that this rectocele lady, she was sitting on a wheelchair, BMI was 37, and she was interrupting a lot, and she just wanted to have surgery. So we have to emphasize on the point also that one important point is that, like before the surgery, it is very important to optimize your weight. Because we have seen in many women that if they go for surgery without optimizing the weight, then the surgery fails and the bulge does not improve. So, and even after the surgery, you have to maintain the normal weight and avoid lifting heavy weights. Don't tell her that because of your weight. Tell her in a general context that in many women we have seen that if the weight is on the higher side and if they're going for the surgery fails, the bulge does not improve. And it is also very important to maintain the normal weight after the surgery. So you have to emphasize on that point, that weight optimization, weight reduction is very important before going for the surgery. Okay. Third scenario. Thank you, Anita. Good one. Okay. Urodynamics, just open the NICE guideline. Just see the indications of urodynamics. I will also share the screenshot. Okay. Yes. Who will come next?
I can do now.
Bushra's voice?
Yes, yes.
Yes. Your voice is very, very low. Very low.
Okay. Okay, now.
Now I think it is little better.
Okay.
Okay. 2 slides. There's one more slide. This one, wait. Okay. Now here, ignore this one, huh? Leakage with activities. There is no leakage with activities. No leakage here.
Okay, ma'am.
Okay, start please if you're ready.
Yes, first bench.
Mhm.
Hello, I am Dr. Usha, one of the doctor in the gynae clinic today. May I confirm your name and age, please?
Yes, I'm Mrs. Emily Parker, 48-year-old.
Okay, can I call you Mrs. Emily?
Yes.
Okay, Mrs. Emily, I can understand from your GP letter you are having some waterward problems. Am I right?
Oh, yes.
Okay. Mrs. Emily, definitely I will address all your concern and then we will make the management plan that is mutually agreed, acceptable and safe for you. How does it sound?
Okay, that's fine.
Okay, before that, can I ask some important question?
Yes, okay.
Okay, can you tell me more about your problem?
Oh, yes, actually, this problem is bothering me too much. I have to rush to the toilet. And sometimes what happens that even before reaching the toilet, I leak urine.
Okay, I am so sorry, Mrs. Emily, you are having a difficult time. Okay, can you tell me, do you have any burning sensation and pain while passing the urine?
No,
Okay, any leakage with coughing and sneezing?
no,
Okay, do you have to strain for passing the pee?
no,
Okay, and any dripping of urine when you pass the pee?
no, no.
Okay, and how often you visit to the toilet? I mean, is there any increase in frequency to visit the toilet?
No, I don't think so. Daytime, I'm going for 7 to 8 times.
Okay,
Nighttime, just sometimes once. That's all.
okay. And do you feel any mass in the tummy and any bulge down below?
No, no,
Okay. Any vaginal discharge?
no.
Okay. And Mrs. Emily, can I ask some question that might sound intrusive but important to formulate better management plan? Can I proceed?
Yes, okay.
Okay. And are you sexually active?
Yes, I am.
Okay. And is this problem is affecting your sexual life?
No, not much.
I mean, there is any leakage during the sexual activity?
No.
Okay. And when was your last menstrual period?
10 days ago?
And your periods are regular?
Yes.
And are you practicing any contraception?
Well, my partner is using condom.
Okay. And are you updated with your pap smear?
Yes, they're normal.
Okay. And do you have any condition for which you are visiting your GP, like high blood sugar, high blood pressure, chronic cough, asthma, constipation?
Mm, I have some cough. Yeah, that's all.
And you are getting any treatment for that?
Yes, yes, and it has improved a lot.
Okay. And how many children do you have?
I have 2 children.
And how the baby were born?
Yeah, vaginal delivery, and yeah, there was no problem actually.
Okay. And do you have any surgeries in the tummy and down below?
No, no,
Any family history of concern?
No,
Okay, and do you have any drug allergy?
no.
Okay, and currently, are you taking any medication for this problem?
Mm, medication? No, I'm not taking anything.
Okay, and I can see your weight to height ratio is 30. And have you ever been thought to reduce your weight?
Well, I'm trying, but it's very difficult for me to reduce weight.
Okay, I can understand. I would like to connect you to the dietitian and exercise expert. They will help you to reduce it.
Yes. Yeah.
Okay. Okay, Mrs. Ellie, can I ask some personal question?
Yes.
Do you smoke?
Yes, but I'm trying to quit smoking
Okay, I appreciate it. And do you drink alcohol?
occasionally.
Okay, and are you taking any recreational drugs?
No, no.
What do you do for a living?
Well, I'm a housekeeping.
Okay, and Mrs. Ellie, how is the sport at home?
Support is okay. My partner is there.
Okay, and do you feel anytime low mood and depressed?
No.
Okay, okay, Mrs. Ellie, do you want to add anything?
No.
Okay. Okay, Mrs. Ellie, thanks for giving me useful information. Now I want to examine you in the presence of chaperone, and also I will review your bladder diary. It is okay?
Yes.
Okay, Mrs. Ellie, let me explain. Have you done any test for urine test
Yes, yes. The GP has done that.
or any other test like blood sugar?
Yes, the GP has done that.
Okay, I would like to review it, and also I review your bladder diary. And from the information that I have gathered from you and from your bladder diary, I can understand you are having the overactive bladder. Uh, have you heard about that?
No, what does it mean?
Mrs. Ali, actually, I can explain you from this diagram. You can see this is the bladder, and this is a water bag that stored the urine, and this is a water pipe through which the urine come out. Sometimes the bladder is involuntarily contractions are there that you may know, might you don't know about that, and it causes the bladder to empty, okay, when it is not full its capacity. Am I clear so far?
Yes.
Okay.
Okay.
Sometimes these contractions are more strong, so you might leak before reaching the toilet, and this
Mhm.
is called overactive bladder. In most of the cases, the cause is don't know, but sometimes there is some spinal injury. Some patient has some central nervous system problem like multiple sclerosis and any operation in the past. Okay, but as in your case, you don't have these problems, but maybe there is no cause for that. Am I clear so far?
Yes, okay.
So, Mrs. Ali, first of all, I would like to inform you how we will manage this one. There are some simple measures that we will take it, and there is some medications are also available, and surgeries is there. For the simple measurement, I would like to advise you as in from your bladder diary, I can see you are taking coffee and this orange juice. So these are causing this aggravation of your symptoms, and also there is if you reduce your weight, it will also improve your symptoms. So I would like to connect you to the dietitian and exercise expert. They will help. And second thing is the bladder retraining. In case of the bladder retraining, our aim is to treat the bladder to hold the urine for more time, and also to decrease the frequency of visiting the toilet. Am I clear so far?
Yes, okay.
You will do this 6 week, and we will review after 6 week whether your symptoms are improved and not. And beside this, we will also advise you to just stop smoking and also to avoid the drinking the alcohol. And if your symptom will be not improved with these simple measures, then we will go for the medicine. And there are the different combination of the medicine that cause the these are antimuscarinic drug like oxybutynin. It keep the bladder relaxed, and so the bladder can full its capacity, and reduce the visiting to the toilet urgency. Rushing to the toilet will be reduced. Am I clear so far?
Okay, yes.
But these medication will be take 4 weeks to be effective, and sometimes the patient has some problem with this medication like dryness of mouth, hammering of feet, and constipation, some mood disturbances. But if you have bothersome of more these symptoms, then we can try and other drugs. This is called mirabegron. This is beta 3 agonist, and this has less side effect. But if your symptoms will be not improved with medicine, then a team of the doctor, including our consultant and the doctor specialist in the waterworks and specialized nurses and physiotherapists, they will arrange the one test. This is called a urodynamic study. Okay, in this test we are to see the how the bladder is functioning and to confirm the diagnosis. When the diagnosis will be confirmed, then we can plan for surgery.
Okay, time is up. All
And
right. So,
okay,
okay,
and
so
now
so which medication will be more effective?
I would like to start from the oxybutynin, and you will take it. We will start from the low dose, and if you will not feel any problem with this medication, then we slowly increase the dose, and we will review it for you after 4 weeks of the
Okay.
medicine.
Okay, fine. Thank you. Okay.
And
So this
I will
was.
provide. Okay,
You want
I
to
will provide.
close the
Yes.
station? Okay.
Yes, I will provide you the patient information leaflet, and you continue your bladder training, and maintain your bladder diary so we can see the betterment of your symptoms or not. And I will fix
Keep
your
it
appointment
short.
next.
Yes, okay. All right. So if you've already given me the patient information leaflet in the beginning and wrote back to the GP, don't repeat it again in the end. No need. Already the box will get ticked. Okay. So you can just say, I can discuss your case with my consultant. Give you the contact numbers and support group numbers. That's all. And the medication will be prescribed by the specialist, the waterworks specialist, because you are in the gynecology clinic here. So you have to involve the waterworks specialist in her care. Okay. So overall, it was good. Overactive bladder and urge incontinence. Okay. So, hello, I'm Dr. Bushra, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? I understand that you have been referred by your GP because you're having some problem with the waterworks, and you are also asked to maintain a bladder diary. Am I right? So, if she tells you about a problem in the very beginning, you have to be empathetic. I'm really sorry to hear about your condition. I can see that it is bothering you too much and it is very difficult for you. Is there any other concern and expectation from today's meeting? So, in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions? And I will also go through the bladder diary. We need to examine you, arrange some tests for you, and then discuss the plan of management. Is that okay? I shall also give the written information leaflet about your condition and write back to the GP about our mutually agreed care plan. Can you tell me more about your condition? For how long are you having it? Did you take any treatment? Anything that improves or worsens the condition? Do you have to rush to the toilet? Do you pass urine even before reaching the toilet? If she tells you about all these on her own, you will not repeat, then you have to ask the questions. Like you will, keeping in mind like voiding dysfunction, hematuria, UTI, and pelvic organ prolapse. So, do you have to strain to pass urine? Any dribbling after peeing? Any change in the color of the pee? Any burning sensation when you pee? Do you leak urine when you cough or exercise? Do you have to get up at night to pass urine? Any lump in the vagina or back passage? How about your bowel work? And can you tell me about your drinking habits? From the bladder diary, I can see that you're taking more of tea, coffee, and alcoholic drinks. If she has a bladder diary, like you have it in the exam, then just correlate everything that, yes, I can see. This is the bladder diary that I can see that you're taking a lot of coffee and tea and beer and also wine. That is the alcoholic drinks. And may I know when was the last periods? How are your periods otherwise? Are you updated with the cervical screening? Are you using any birth control method? I would like to ask you some personal questions. Are you with someone now and are you sexually active? Any leak or problem during sex? May I know, have you ever been pregnant before? Can you tell me more about your pregnancies and deliveries? Any difficult or traumatic delivery, use of any instruments? Any water work problem with you after your deliveries? If she says no, there wasn't any problem, everything was okay, then you don't have to ask these questions. So, are you following GP for any medical condition like diabetes, hypertension? Okay, so I have cough and I'm taking treatment for that. So, how is your cough now? Has it improved? Yes. Are you on any other medication, any allergy? Complete the surgical history, family history, smoking, alcohol. For the smoking, you don't have to signpost. You can ask directly that, may I know, do you smoke cigarettes? Occupational history, partner and support. Have you been feeling lower down? If she says yes, then you will arrange appointment with the counselors. I can see your weight height ratio is 30. Have you tried anything to lose weight? Thanks for these informations. Would you like to add anything important? I would like to examine you with your permission and in the presence of chaperone to assess your general condition. Check your tummy to get a feel of tummy and check you from down below. We'll ask you to cough to see from where you are leaking urine. Is that okay? May I know any tests were done, like urine test for infection and the blood test for blood sugars? Okay, so GP has done these tests, and are you aware of the result? No. So I will be asking your GP for the result. Now, coming to the condition from the history examination and looking at your bladder diary, most likely you are having a condition known as overactive bladder. Have you heard about it? So I can draw and explain it to you. See, this is the water bag which stores urine, and in this condition, the muscles of the water bag, it contracts even before you are ready to go to the toilet or even before the bladder is completely filled with urine. Sometimes the contractions are so strong that you leak when you are rushing to toilet, even before you reach the toilet. Am I clear so far? Okay. And what is the cause? Exact cause is not known. It can occur in all ages. It can happen because of some problem in the nerves of brain or back. And the drinking habits and the type of drinks you're taking can also influence your symptoms because these are bladder irritants. The tea, caffeinated tea, coffee, cola, fizzy drinks, green tea, alcohol, the beer and wine, these are all bladder irritants. So they can aggravate your condition. Any questions? So regarding the management option, we can offer you the simple measures, exercises like bladder training. We can offer you medication and surgery is offered as a last option. Do you have any preferences? Is it okay if I discuss these options one by one? So regarding the simple measures, I can see your weight height ratio is on the high side. So we can refer you to the dietitian so that you can have healthy balanced diet. And also we will help you to enroll in some exercise programs. Losing some pounds will help to improve your condition. Also, I will advise you to cut down on the caffeinated drinks like tea, coffee, and alcoholic drinks. Regarding the drinking habits, try to drink fluid up to 1.5 to 2 liters and try to reduce your fluid intake in the evening. At least stop taking fluids 4 hours before going to bed. Just a minute, give me a few seconds. I will be back. One moment. All right. Regarding the bladder training, we can offer the bladder retraining. This will be done by the specialist nurse or physiotherapist. They will teach you how to train your bladder to hold more urine, and this is done for 6 weeks. And we will also track the progress. We will arrange appointment at 6 weeks to assess your condition, whether it has improved or not. Any questions so far? And if the condition doesn't improve, then we will offer some medications known as anticholinergics. They keep the bladder muscle relaxed while the bladder fills up, and they prevent the bladder from contracting and from emptying the urine when it is not full, and this helps to improve the symptoms. They can cause some side effects like dry mouth, dry skin, constipation, and you can feel your heart beating faster. If you have dry mouth and constipation, it means that medication is starting to have an effect. This will be prescribed by the waterworks specialist, and it is started with low dose. Takes about 4 weeks to show the effects. Emphasize on this point 4 weeks, because the patients, if she will keep if she's taking for 1 to 2 weeks, there is no improvement, she can leave. She will just stop taking it. So you have to tell this has to be taken for 4 weeks. After 4 weeks, we will arrange the follow-up appointment, either face-to-face or on telephone. Before 4 weeks, if you have any problem, and if you have severe side effects or not able to take the medication, please feel free to inform us. There is another medication known as mirabegron. It has got less side effects, and this is also prescribed by the waterworks specialist. If the medication doesn't work, we will offer surgery as a last resort. Would you like me to tell in details about the surgical options? So, before the surgery, actually, we have to offer you the special bladder test known as urodynamics to make sure that you are having the condition of the bladder and to confirm the diagnosis of overactive bladder. And only once the diagnosis is confirmed, we will offer surgical options. Your case will be discussed in a meeting by a group of experts, including my consultant, waterworks specialist, specialist nurse, and physiotherapist. They will come up with the most suitable surgical option for you, and your wishes will also be taken into consideration. So in the exam, there won't be time for you to discuss the surgical option. So she will say, okay, doctor, so which medication is suitable for me? So yes, we have these 3 types of medication, and the waterworks specialist will discuss with you which one is the most suitable, and he will be starting you on that. In the meantime, do the simple measures and do continue with the bladder retraining exercise. If she wants to know about the surgical options, keep it very simple, explain in the simple language that regarding the surgical options, we can inject material into the bladder known as the botulinum toxin. It is repeated every 6 to 12 months because the effect wanes off with time. After this injection, you may have some problem and you have to strain a lot to empty your bladder. So you will have to use a tube to empty bladder. And we can also offer the electrical stimulation. This treatment can change the activity of your bladder, and in this there is electrical stimulation of nerve in the lower back which supplies the bladder. Initially, the test stimulation is done, which lasts for 2 weeks. Now, if this improves the symptoms, only then you will be offered the operation to implant a permanent nerve stimulator, and it can last for a few years. We can also insert a small piece of bowel inside the bladder to increase its size, and it is a very invasive procedure. There is risk of infection, some risk of sinister changes, and this surgery will be done at higher specialized centers. Any questions? So we can discuss all these options later on in our next meeting. So as of now, I will discuss your case with my consultant, arrange appointment with the dietitian. Our specialist nurse will explain to you about the bladder retraining, arrange follow-up at 6 weeks, maintain your bladder diary, give the support group and contact numbers for clinical access. Okay, any questions? No. Thank you. Okay, Bushra, thanks. Keep it up. Next, Dr. Shanti, you can come now. Okay?
Ma'am.
Yeah, fine, good. Wait. Yes. Take your 2 minutes, you have 2 slides.
Yes, ma'am. Next slide.
Mhm.
Previous slide. Yeah, can you start, ma'am?
Yes, start, please.
Hello, I'm Dr. Shanti, one of the doctor in the gynec clinic today. Can I check your name and age, please?
Yes, I'm Claire Simpson, 35-year-old.
Hello, Claire. I can see from your case notes that you are here today, that you have some lump in the anterior part of the vagina, as well as you are having some recurrent infection. Is that right?
Yes.
Any other particular concerns you want to discuss in this meeting? Can you tell me in your own words what is your symptom is about?
Oh, yes, actually, I have this bulge, like it is a small lump down below, near the opening of my water pipe. And also, I'm having repeated water infection. And I'm taking a lot of antibiotics, but my condition has not improved.
I'm very sorry to see you, Claire, in this condition. So anything makes this lump increase in size or decrease?
No, nothing in particular.
So what about the water works? So do you leak urine or do you rush to the toilet?
No.
So if you just press this swelling, is that urine comes out or any pus coming out?
No pus, but yes, there is dribbling of urine.
Okay, fine. So what about the bowel works? So do you have any difficulty in bowel opening?
No.
Okay. So some personal questions. Are you sexually active?
Yes, I am.
Is it affecting your sexual life as well?
Oh, yes, too much because of the pain, we are not having like it is, yes, affecting my sexual life.
Oh, I'm very sorry. We are here to help you. So is it affecting your quality of life in any way?
Oh, yes, I'm fed up of this condition. I'm taking antibiotics on and off, and still there is no improvement.
Oh, I'm very sorry. So do you have a burning in the pee as well as blood in the pee?
Yes, there is some burning when I go to pee, but no blood.
Okay. So what is the treatment taken till now?
Only antibiotics.
Okay, fine. So what about your periods?
Yeah, periods are okay. Last one was 1 week ago.
So do you use contraception as well?
Oh, yes, my partner is using condom.
So, okay. What about the cervical smears? Are you up to date with your smears?
Yes, they are normal.
Okay. So what about your previous pregnancies and deliveries? Can you tell me about that?
Yes, there was no problem actually. I have 3 children. They were delivered vaginally.
Is there anything like difficult forceps delivery like that?
No.
Any waterwork problems after that?
No.
Okay, fine. So how about your any other medical conditions for which you are following the GP?
No,
Any allergies?
no, no.
Okay, from any, what about your blood group?
A positive.
Any reservation for transfusion?
No,
Any surgeries done in the down below or in the tummy?
no.
Any family history of significance,
Mm,
like clots?
no, no.
Okay. Do you smoke?
Yes, I do.
Oh, smoking is not good for your general health as well as for these conditions. If you anytime you have you thought about quitting smoking?
Okay, if it will help me, then I will do that definitely.
Yeah, I will put in touch with NHS Stop Smoking Services. Is that okay for you?
Yes, okay.
Do you drink alcohol?
Occasionally.
Sorry to ask, any recreational drugs?
No, no.
So what do you do for living?
I'm an engineer.
Fine. So is the partner supportive?
Oh, yes, he is.
Okay. In the past 4 weeks, have you ever been depressed or anxious?
Well, yes, because of this condition, I feel very low at times.
Oh, I'm very sorry. I will put in touch with the counselors. How it sounds?
Oh, yeah, that's okay.
So your GP has given the findings as well as the picture. If you allow me, I would like to examine you in the presence of chaperone.
Okay.
Okay, then I will see the mass. So from where the lump arises, and I will make you to cough and then see whether there is any urine leaking. Is that okay for you?
Right. Okay.
Yeah. So the condition which you are suffering is like you have some dribbling after maturation as well as you have pain during sex, and there is a lump also. Putting all these things together, and we are suspecting that this can be due to urethral diverticulum. Have you heard about it before?
No, what does it mean?
Let me draw it and show you. See, in the anterior, that is in the front wall of vagina, the uppermost opening is the urethra, and the below is the vagina. Okay, and there will be the water bag will be upper, and there will be water pipe below, which brings the urine outwards. Okay, so this urethral diverticulum is nothing but an outpouching which develops from the water pipe into the vagina, and the urine collects in this outpouching and it dribbles as soon as you stops urinating. So am I making sense?
Yes. Okay.
So why this happens is this can happen because of difficult childbirth. So like forceps or a vacuum delivery or a big baby like that, whenever there is some complication occurring during delivery, as well as sometimes there can be obstruction of some gland ducts can happen. Okay.
Yes.
So we have to investigate that. So the GP has done some there is urine infection test. So we have to repeat the test to see what is the bugs growing in the urine, as well as your treatment will be by a group of doctors. That is, we will put in touch with what is called waterwork doctors called urologist, specialist nurse called continence nurse, as well as the GP, and everyone will be taking care of you together. And we'll do further test called a camera test, whereby a small you will be made to sleep, and then we will pass a small camera inside your water pipe and look inside the bladder how the bladder is, and we may take some tests, some samples also if needed. Okay.
Right.
And there are special x-rays called MRI which will be done in the x-ray department to know exactly what the mass is. Okay, and then there are special dye test called micturating cystoerythrogram, whereby we give a dye and take X-rays and see where these dye goes to know more exactly about how the lump is.
Okay.
Okay, so regarding the management, so what the surgery is the definitive treatment for this because it is bothering very much your quality of life. The simple medications is not treating you, so we have to go for the next step called surgery. Okay, surgical method. So what we do in surgery is it has to be done by the expertise called waterwork specialist. This is a simple surgery, but since the place is a very crucial, that is, it is near the place where the blood supply will be heavy, and it is near some it is near the vital structure, so it should be done by the expert surgeons. And what it involves is we will widen the neck of that sac, or we will just remove the sac as well. There are, okay,
Right. Yes.
There are certain complications can happen due to this surgery. So what are the complication is, there can be heavy bleeding, there can be infection. Sometimes what happens is you can leak urine. After the surgery, there may be the urine flow may be altered, that is you can leak urine. Or you may also, so we have to do some special test before the surgery called urodynamic study, that is how the bladder works. We will just do it before surgery, so that if the leak happens afterwards, we can know whether it is present before or after. Okay. And sometimes, very rarely, a fistulous tract, that is a connection can happen between the vagina as well as the water pipe. It is one of the serious complication. And if this is kept left without surgery, then in long standing cases what happens is, so keep on, the infection will happen and there can be formation of stones, or sometimes a sinister lesion can happen, or sometimes what happens is, it can cause many problems like leaking. Okay, what can happen, and
Right.
it can affect quality even more.
Okay. And can you give me antibiotics like for long-term use? Can I use that?
No, you cannot use for that, because
Yes, because.
check what's if you are not treating this condition, if you are just taking antibiotics, as I said, it can lead on to stones and other problems later on, like sinister changes can happen.
Okay. Right.
So I will give you the patient information leaflet for you to study, and then I will write back to your GP about our treatment plan. And then I will put in touch with a radiologist, like X-ray doctor, regarding your further test, and I will refer you to the water specialist doctor also.
Okay.
Okay.
Yes, yes.
So we will also give you 24-hour contact number. Meanwhile, if you have any problem, you can contact us.
Okay.
Yeah.
So yes, you just finished on time, and I think you have done this station really nicely. I think from my side, nothing to add. We talked about the investigations, the treatment, surgical treatment, because antibiotic is not helping to improve her condition, and long-term antibiotic use not recommended if the patient is not having any UTI. Okay. All right, so you're in the gynecology. Hello, I'm Dr. Shanti, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Claire. I understand you have been referred by your GP because you're having a lump in the vagina and repeated water infection. Am I right? Is there any other concern and expectations from today's meeting? So in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions? I may need to examine you and then discuss the plan of management. Will that be okay? I shall also give the rich information leaflets about your condition and write back to the GP about our mutually agreed care plan. So can you tell me more about your condition? Since when are you having the lump? Anything that relieves it? Anything which worsens it? So if she doesn't tell on her own that when I press the lump, urine dribbles out. So you have to ask that leading question. So may I know, when you press the lump, the urine dribbles out? Okay, yes. So that is something very important. Any difficulty during passing urine? Any leak of urine at other times? Do you have to rush to go to the toilet? Have you noticed any change in the color of urine? Any burning sensation? Any heaviness in the vagina? So, is it affecting your quality of life? Yes, it's bothering me too much. I'm sorry to hear about that. How are you coping? May I know when was the last periods and how are the periods otherwise? Are you updated with your cervical screening? Have you been using any birth control method? Sexual history after signposting. I would like to ask you some personal questions. Are you with someone now and are you sexually active? Any difficulty during sex? Is it affecting your sexual life? I'm sorry to hear about that. And have you discussed about this with your partner and what are his views or opinion? Any history of sexually shared infection? May I know, have you ever been pregnant before? Can you tell me more about your previous pregnancies and deliveries? Ask about the medical history, medical condition, medication, allergy, surgical history, family history. Occupational partner and support, smoking, yes, you have to offer her energy stop smoking services, alcohol, recreational drugs. Have you been feeling low down? Yes, I'm too much bothered with this condition. So we can put you in touch with our expert counselors. Will that be okay? I can see your weight height ratio is 24. Am I right? If you want to ask the blood group, it's okay. You can ask the blood group because you will be talking about the surgery. Thanks for these informations. Would you like to add anything important? I would like to examine you with your permission and in the presence of chaperone to assess your general condition. I would like to check your tummy to get a feel of tummy. Check you from down below to assess the size of the lump and to see from where it is coming. Will that be all right? If she's refusing examination, ask, why are you refusing examination? Because it will be very painful. I do understand that, but I will be very gentle. And if you have pain at any moment, you can stop me. So, like you can just say that examination will help me to see if there is any new finding. If she doesn't want examination at all, tell her, okay, I respect your wishes and I won't examine you without your permission. All right, so she will say, GP has sent the picture or I have this picture. So can you see? Yes. So from the picture and from the information which I have gathered, most likely you are having a condition of the waterwork known as urethra diverticulum in medical terms. In the exam, she said, what are you talking about? Doctor, this is urethra diverticulum. I mean, what type of term it is? I'm not able to understand. I know the terminology is a bit difficult, so let me explain to you. And you can explain on the picture itself that, see, you can see here, this is your genitalia, and here on upper side, there is the opening of the water pipe. That is here, the opening of urethra. And down below, this is the vaginal opening, and you're having a lump near the opening of the water pipe. So what is happening? That there is a formation of the pouch or pocket near the opening of water pipe, and you can see that this is the pouch over here. Instead of saying lump or swelling, better word is pouch. So when you pee, urine gets collected in this pouch, and when you press this pouch, the urine comes out. Also, you're having repeated water infection, and this can happen because opening of some gland can get blocked, and because of this repeated infection, you're also having pain. Any questions? She will give very nice history in the exam, dysuria, dyspareunia, and post-void dribbling. So don't get confused with cystocele and erythrocele. Cystocele and erythrocele, they don't usually cause so much of pain, dysuria, and dyspareunia. There will be some discomfort, of course, but they are not so painful condition. In fact, painless condition. Now coming to the management, so we can offer the medications, that is antibiotics, if the condition is mild, or offer surgery when the condition is severe. But you can add your own lines that I can see that antibiotics are not helping. So is it okay if I discuss about the surgery? Or you can say, do you have any preferences? And she might say that I want surgery, antibiotics are not helping me at all. Yes, I can see that the condition is really bothering you too much. So, doctor, can you tell me about the surgery? Yes. Either you can start with the surgery first and discuss the investigation. So, yes, regarding the surgery, the pouch is divided from the urethra and it is removed. Okay, so this one is, you don't have to use the terms diverticulectomy or anything. This is for everyone, okay, because she will not understand. So just keep it simple that the pouch is divided from the urethra, that is the water opening of the water pipe, and it is removed. So the pouch will be removed completely. And the wall of the water pipe is then closed with stitches, and a catheter or a tube will be inserted for a few days to help you pass urine and help in healing. Surgery will be done by the expert waterworks specialist. The surgery is quite simple but complex because the area is very sensitive. It is rich in blood supply, so the surgery needs to be done by experts, otherwise it can worsen the symptoms you are having. Okay, and talk about the risk of surgery, that there is risk of pain, infection, and bleeding, and we will be giving the medications to reduce these risks. And there is risk that condition can come back again. You can leak urine. There can be a connection between the vagina and the water pipe, and all the precautions will be taken to prevent these complications. Now, if surgery fails and condition comes back again, you will be offered another surgery. So in this, what it involves cutting the neck of the pouch and widening it so that the urine doesn't get collected in the pouch. So this is re-roofing. So first surgery is removing the pouch completely. When there is recurrence, we are not removing the pouch. We are just cutting the neck of the pouch and widening it. That's all. So re-roofing. Marsupialization, don't discuss in this lady because it is done in old and frail women. Just you should have an idea about the marsupialization that and, in this surgery, we make an incision on the pouch and open it and close the cavity with some substance like cellulose so that urine doesn't get collected. So if in the station you have old, frail woman in that situation, you are going to talk about marsupialization. So it is very important to treat this condition. Otherwise, what can happen in the long term? That you can leak urine, risk of stone formation is there, repeated water infection, and risk of severe infection. It can cause collection of pus, and there is risk of some changes of sinister changes. Okay, some chances of sinister changes. Questions. But don't forget to talk about the investigations. Before the surgery, you will be offered a camera test in which telescope and camera will be inserted inside to have a look at the bladder. And also some samples will be taken and sent to the lab because to rule out any sinister changes. Because the condition may be associated with some sinister changes. Offer you some specialized scans like MRI done by the scan doctors. Also, they may need to inject the dye and do X-ray to see where the dye is going and whether it is getting collected in the pouch. Also, we have to offer you some special tests of the bladder known as urodynamics. Have you heard about them? So this is done to see whether you leak urine when you exercise or cough, because sometimes leak can occur as a complication of surgery. So we have to rule out and make sure that you don't have such problem like leaking urine from the beginning. Okay, any questions? All right. So as of now, I will be discussing your case with my consultant, arrange appointments with the waterworks specialist, give you the contact numbers and the support group numbers. Any questions? No, thank you. Okay.
Excuse me, ma'am.
Yes.
We will offer the patient all these investigations like MRI, video
Yes.
urodynamics, cystouro,
Yes.
urethral cystoscopy, all.
Yes.
Also MRI.
It is important. Yes, yes. TOG. Just open the TOG and see the investigations which are being given to this, which are done for these patients. Okay. Everything is from the TOG and the patient information leaflet. Everything.
Yes, I read doc, written these investigations. But if the examiner will ask why, I mean, so should be reason. Now, okay, I can understand video urodynamics is necessary and this urethral cystoscopy. But then what is the benefit of then? I mean, all will give the clue
Just
for
read
this.
the TOG. Read the TOG and you will see why. And read the TOG and you will understand why. That is because we have to confirm. One is that we have to confirm the diagnosis. Camera test cystoscopy, we know. Cystoscopic directed biopsy has to be taken to rule out any sinister changes. All right, and specialized scans, MRI has to be done. MRI will also confirm the diagnosis and the nature of this pouch. Dye, they have to see and do X-ray. They have to see where is the dye going, whether it is getting collected in the pouch, where it is going. That is why we have to see that. And urodynamics before the surgery to exclude stress urinary incontinence. But open the talk if you have any confusion. Open the talk yourself, read the investigations part only, and it is very nicely given in the talk. Okay. Next, Maria.
Yes.
Come. All right. Okay, just a minute. We were discussing this overactive bladder. So for the overactive bladder, this case was presented by Bushra itself, right? So first line, lifestyle modification, simple measures, weight reduction, if high BMI, fluid management, bladder training, medications. If no improvement, then urodynamics and MDT. Second line is all the invasive treatment and the surgical treatment. Okay, your case.
Okay. Right. Is there any next slide?
No, just this one.
One slide. Okay.
Okay, start, please.
Hello, I'm Dr. Maria, one of the doctors covering the Urogynaecology clinic today. May I confirm your name and age, please?
Yes, I am Mrs. Violet Davidson, 48-year-old.
How may I address you?
Call me Mrs. Davidson.
Okay, Mrs. Davison, I understand you have been referred by your GP as you are having some waterwork problem. Is it so?
Oh, yes, actually, I don't know what's happening to me. There is leak of urine when I cough and do exercise, and it is really bothering me a lot.
I'm really sorry to know about it. I can understand. It is really bothering you a lot. Mrs. Davidson, actually, my consultant is on leave. She's sick, so she's on sick leave. So on place of her, my nurse has called me to check you. So will that be okay? I continue consultation, or would you like to have another consultant? A consultancy. I mean, you want to fix another appointment?
Yeah, that's okay. So may I know, are you working with Dr. Kate?
Yes. I'm working here as a STIFI registrar, and I'm working under the doctor.
All right. Okay. Yes. Hello. Yes, Maria. Hello. Some network. Yes, there is some connection problem. I can't hear your voice.
Yeah. Can you tell me more about your condition? For how long have you been having this problem?
Yes, for the last 6 months, and it's not improving actually.
Okay. So you feel leakage of the urine during cupping and during
Yes.
lifting heavy. Is it so?
Yes.
Okay. Is there any leakage? I mean, whenever you feel to pass urine, I mean, before reaching the toilet, do you have any leak?
No.
Okay. Do you rush to the toilet for passing urine?
No.
Okay. Any burning maturation? Any burning urination?
No.
Okay. Can you tell me that did you take any treatment for this problem?
Well, I'm doing the pelvic floor muscle exercise, but it is not improving my condition.
For how long have you been doing this exercise?
It is about 3 to 4 months now.
Okay. So are you doing under supervision of physiotherapist?
Yes.
All right. Okay, Mrs. Davison, I want to know about that. When was your last period?
Yeah, that was 10 days ago.
It's regular.
Yes.
Are you updated for cervical screening?
Yes, and they're normal.
Okay. Are you using any form of contraception?
My partner is using condom.
All right. Okay. Any history of surgery of tummy or down below?
No.
All right. Are you following your GP for any medical condition?
No.
Any history of cough or constipation?
Yes. I have this cough and sometimes constipation, and I'm taking treatment for that.
So do you have relief from these medications?
Yes.
Okay. All right. Okay. Are you taking currently medication apart from these other medication? I mean,
No.
are you allergic to any medication or any substance?
No.
Okay. Any family history of concern?
No.
All right. Sorry for asking some personal questions.
Mhm.
You with someone now?
Yes.
Are you sexually active?
Yes.
Okay. So any history of sexual sharing infection in past?
No.
Okay. Are you aware about your weight height ratio?
Yes, it is 26.
All right. What about, yes, do you smoke cigarettes?
Yes, I do.
And what about alcohol? Do you drink it?
Occasionally.
Pardon me for asking, recreational drugs?
No.
Okay. May I know what are your thoughts about smoking and alcohol? Have you ever tried it?
Okay, if quitting will help, I will definitely do that.
Yes. So, Mrs. Davidson, with your permission, we can connect you with our NHS Stop Smoking and Alcohol services. And these services help you a lot regarding quitting it. Okay.
Right.
Okay. So, Mrs. Davidson, thank you for this information. I would like to perform an examination with your permission in presence of Chevron. I would like to assess your general condition and do tummy examination to get feel of tummy and also down below to see any bulge down below. And also I will ask you to cough. I will to demonstrate the urinary leakage. Okay. Will that be okay if I do all this?
Okay, fine. Yes.
Thank you so much. Okay. So Mrs. Davison, coming to your, problem, concern, on the basis of your history and examination, actually you are having problem of stress urinary incontinence. Do you have any idea about it?
Yes. The GP told me about it, and he was saying that there is some problem in the angle of the water bag and so many things. So I want to know about the treatment, how to manage this. I really want to get rid of this condition.
Yes, you are right. And this problem is due to distortion of the angle of the bladder and the neck of the bladder if there occurs problem. Yes, I'm coming to further management. Basically, there are the different options. We just advise the patient for the general measures, which includes the lifestyle modification. As I can, your weight is BMI is 26. It is bit higher side, right? So you need to reduce your weight too. Okay, for this, we will refer you to the dietitian, and also we will advise you to enroll in exercise program. And also, as you are having history of smoking and alcohol, so you need to cut down it also. And if you and also for cough, currently you are taking medication, so of course it is mandatory to get rid from this problem. because it is also one of the reason of this problem. And also, you have done, I mean, pelvic floor muscle exercises for last 4 months, and that is quite enough time. And despite of this, you didn't get any benefit from it. In that situation, we have to move forward for other, procedures. So there are some other methods we can treat you by these, like there are medical treatment option as well as surgical intervention. Of course, surgery is a definitive treatment option. Are you with me, Mrs. Davidson?
Okay, so can you tell me more about the surgery?
Yes, Mrs. Davidson. There are the two types of the surgery we usually perform. One is the colpo suspension and other is the sling surgery. Let me tell you that what do you mean by the colpo suspension? Actually, it is a major surgical procedure, and we do it through a tummy or by keyhole surgery. And in this surgery, our purpose is to maintain the angle that has fall down, that has distorted. Okay, so we take the stitches at the side of the bladder neck and we just pulled it up, and in this way angle will be maintained, and during cuffing or lifting heavy weight you will not leak more. And also, as this is a major surgery, so there are the risk of the pain, infection, bleeding, and also damage to the bladder, bowel, and blood vessels. Well, it will be done by the expert surgeon. So we will try to prevent all these complications. And other surgery is sling surgery, in which also the same to hold up the angle upside, I mean to maintain the angle. So we also, what we do, we take the tissue from the patient's body, from tummy, I mean muscle, from the tummy or thigh, and we just insert just below the neck of the bladder, and we give the cut at the through the vagina and in the tummy. Okay, so the purpose will be same, to hold up the neck of the bladder. So after doing this, of course, you will be able to hold the urine during cupping or during lifting heavy weight.
Okay,
Am I
time.
clear?
Yes, okay.
Okay.
Any
So
any tests before the surgery?
yes, we will offer you some blood test, and also we will offer you, yes, we will offer you some blood test, and like liver function test and kidney function test and full blood count.
Urodynamics.
All right. Yeah, but urodynamic in this case, she's having isolated urinary incontinence. She's not having any prolapse.
Before
So,
surgery. Before surgery. Sorry, it's
Is
not urodynamics. MDT.
No, no.
MDT.
Yeah.
It was
MDT.
slipped from my
Yeah.
mind. Yes,
It
yes.
didn't involve.
Yes. Test you are okay.
Yeah.
And it has to be MDT. I wanted to say MDT, but by mistake I told urodynamics.
MDT, I didn't involve. We will involve the MDT, involving my consultant, specialist water work, and also bowel surgeon, and physiotherapist, and dietitian, and UG. All will be involved, and they will definitely come up with a test plan, and we will inform. Okay.
Right. Yes.
So I will be giving you these information leaflets, and also I will be writing back to you regarding our mutually agreed safe plan. And also I'm going to fix your appointment with my consultant in next 4 weeks. Will that be okay with you?
Okay. Yes. Thank you.
Thank you so much for your time.
Okay. Thank you. So don't forget about, after talking about the surgery, it has to be MDT, and they are the ones who are going to decide. And if she
Yes.
asks whether will you use mesh in my surgery? So what will be?
No, actually, mesh are not recommended these days because it has got a lot of complications. There are the risk of the erosions. I mean, mesh can enter into the vagina as well as in bladder. So due to these complications, we do not recommend.
Exactly. No mesh. Right. No mesh in prolapse surgery, no mesh in your incontinence surgery. Not at all. All right. So let's discuss. Hello. Hello, I'm Dr. Maria, one of the doctors in the gynecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Mrs. Davidson. I understand you have been referred by your GP because you're having some problem with your waterworks. Am I right? You're here to see my consultant, Dr. Kate, but she's on sick leave, and I'm sorry for that. I have been asked to see you, so is it okay if I carry on with the consultation? Is there any other concern and expectation from today's meeting? So in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions? I may need to examine you, arrange some tests, and discuss the further plan of management. Is that okay? I shall be giving you the written information leaflet about your condition and write back to the GP about our mutually agreed care plan. How does that sound? So can you tell me more about your condition, about your whatever problem? Since when did it start? Do you still wet yourself? I can see that you're doing the pelvic floor muscle exercise. Are you still doing it? Since when or for how long? And are you doing it under the supervision of a physiotherapist? So was it helpful? No, she would say, no, my condition is not improving at all. And from the GP letter, I can see that you leak urine with cough and exercise. Am I right? Is it affecting your quality of life? How are you coping? Do you leak urine at other times also? Do you have to rush to toilet to pass urine? Any pain when you pass urine? Do you have to strain? Or is there any dribbling after you wee or after you pass urine? Do you get up at night to wee any lump in the vagina or back passage? How about your bowel opening? Gynae history, ask about the last periods. How are your periods advice? Cervical screening, contraceptives. Sexual history after signposting. Are you with someone now? Are you sexually active? Any leaking with sex? You can ask this question as well. So, have you ever been pregnant before? Can you tell me more about your pregnancy and deliveries? Any difficult or traumatic delivery? Instrumental delivery? How was your recovery? How's your baby doing? Okay, baby is grown up now. She will say, I have two grown up children. She's 48 years old lady. So, but just touch the point of this one, ops history. Okay, medical history. Are you following GP for? I can see that you're having cough. So, is there any other medical condition you're following your GP for? And are you taking the treatment for your cough? Any improvement? Okay, any other medication? Do you have any allergy? Then, surgical history, occupational history, partner and support, smoking, alcohol. Occupational history, did you ask me? I think no.
We didn't know.
No, because I was waiting to say house. I'm a housekeeping. No, you didn't ask me. Have you been feeling low or down lately? And if so, then we can put you in touch with our counselors. I can see your weight height ratio is 26. Thanks for these informations. Would you like to add anything important? So I would like to examine you with your permission and in the presence of chaperone to assess your general condition and examine your tummy to get a feel of tummy and down below to check for any mass and to see the urine leak. While examining, I will ask you to cough to confirm the leakage. Is that okay? Also, we will arrange some tests for you, the urine test for infection and the blood sugars testing. So may I know, did your GP, has your GP done these tests? So are you aware of the results? Okay, they're normal. That's good to know. Now, regarding your condition from the history and examination, most likely you're having the condition in which there is involuntary leak of urine. This is known as stress urinary incontinence. Have you heard about it? Yes. The GP has already diagnosed about the condition. So in these stations, the patient will tell you that, yes, doctor, I know everything about this condition. So may I know how much do you know about this condition? Yes, you're right. So would you like me to explain more? No, I'm not interested. She will say, doctor, can you tell me about the management? So just don't explain and waste your time. Go to the management. Regarding the management, we can offer you the simple measures, lifestyle modifications, and and also the exercise which you have done, but you're saying that it has not improved your condition. And surgery is offered, and there is also some medication. So, do you have any preferences? Yes, I'm fed up of this exercise. It has not improved my condition, so I would like to know more about the surgery first. All right. So, regarding the surgery, they are of two types. Both the surgical procedures are basically the same operation with the same result. And aim of surgery is to maintain the angle between the water bag and the water pipe by pulling it back. Because in this condition, this angle is lost. So we have to maintain this angle. This is done by placing stitches between the bladder neck and water pipe. There is one surgery which is known as colposuspension. Suspension. This is done by making a cut on the bikini line or by keyhole surgery done by either putting you to sleep or giving injection in your back to make you numb from waist down below. Success rate is about 9 in 10 women. There are some risks like pain, infection, bleeding, recurrent water infection. There can also be a bulge in the back passage, but it doesn't cause any problem and it will not need any treatment. Another procedure is the sling procedure. In this, sling is placed around the neck of the bladder, or we can use muscle from your tummy or thigh, and this is done by making a cut in your lower tummy and vagina. Am I clear so far? Any questions? Before the surgery, very, very important, patient safety and applied clinical knowledge and communication with colleagues. It will cover a lot of points. Before the surgery, your case will be discussed in a meeting by a group of experts, including my consultant, waterwork specialist, physiotherapist, occupational therapist, specialist nurse, and the bowel surgeon. They will review your case and they will come out with the best management plan for you. Your wishes will also be taken into consideration. And your health data will also be entered into National Incontinence Register, and a copy will be given to you. Regarding the follow-up after the surgery, it is at 6 months, and we will inquire whether your symptoms improved or not. And before that, if you have any problem or any concern like pain or water infection, vaginal bleeding, report to us immediately. And for that, we are going to give the contact numbers. So while waiting for the surgery, I will also encourage you to do the exercise. And anyway, not exercise, she's already done this. Maintain the healthy weight and try to stop smoking. Just tell her about some lifestyle modifications, maintaining heavy weight and stopping smoking. Okay. Can you do mesh procedure? At the moment, mesh procedures are not recommended because of risk of complications with mesh like mesh erosion. They can enter into vagina or bladder. They can cause severe pain and sometimes removal may be difficult. They can also cause painful sex. So may I know what are your thoughts about your options? If she asks any question like, can you do mesh procedure or like in the urethra dive, no, that bladder pain syndrome, I asked the question that can I use, can you give me antibiotics for long-term use? So just tell her, yes, I do understand your concerns and it is a very valid question. Don't say no, 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 no. I mean, it comes spontaneously from our mouth. I know it happens. We are all human beings. If she will ask, can you do the mesh procedure? No, 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 no. We don't do mesh nowadays. Give yourself some time, few seconds. So, yes, your question is very valid and I do understand your concern. Then tell your answer. Okay. Now, the other methods are mostly the station. There is no time to talk about the bulking agents at all. But if she wants to know about the other methods, then yes, we have the bulking agents, then artificial valve and some medication. Would you like to know more about them? So these bulking agents, actually, these are glue-like substances. They are injected in the water pipe. They help to increase the bladder capacity so that the bladder can hold more urine. Before using these agents, your case will again be discussed by the group of experts, which I just explained. So you don't have to repeat again the MDT. There is actually no risk of surgery or anesthesia. No cuts are made. You will be having quicker recovery, shorter hospital stay. Success rate is about 7 in 10. However, the long-term success rate is less and effect will decrease with time, so injections may have to be repeated. You may also have difficulty in passing urine, so you will be taught to use taught to use a tube that is catheter to empty the bladder. Now, there is another option of inserting an artificial valve or sphincter. This is done as a last resort if all surgeries fail. This valve is placed to close the opening of water pipe so that urine does not leak. And these are all very invasive procedures done at specialized centers only. Okay. Now, there was a station where the patient just wanted to know about duloxetine. So you have to talk in detail about duloxetine that, yes, we can offer a tablet which helps to contract the muscles around the bladder and water pipe and helps to keep it closed so that you don't leak. It is effective for as long as you're taking it. Effects are seen after 4 weeks of taking it. Remember this 4 weeks in these medications. It can cause side effects, nausea, vomiting, constipation, dry mouth, sleep disturbance. However, these side effects are mostly when you first start taking the tablets. So first slow dose is started and then the dose is increased gradually. Medication will be given by the experts, the waterworks specialist. Any questions? No, thank you. So in stress, urinary incontinence, first line management, weight loss, treatment of cough, constipation, pelvic floor muscle exercise for 12 weeks. If no improvement, then we offer surgery. Before the surgery, MDT is very, very important. No role of urodynamics. Second line management, surgery, which will include the colpus suspension or link procedure. Again, no improvement, MDT. Then we have to talk about the third line, the bulking agents, artificial sphincter. If patient refuses all surgeries, only then we are going to talk about the duloxetine. We are not going to talk about it on our own because we know it is not recommended even as first line or second line management of stress urinary incontinence. Clear? Okay. One more. Who will do? Dr. Shanti, you can. Whose voice it was?
Maria was speaking, Dr. Shabana. Can I ask one question?
Yes, ask please.
Yeah, I just want to confirm that as you said, and of course I have read also that mesh are not recommended even in prolapse surgery or for stress urinary incontinence. So we are offering in case of ward prolapse patient sacrocolpopexy. We also put mesh on the picture.
Not now. There is a new this MHRA guidance. It came, the Cochrane review and all. I will see and I will share the screenshot. No more mesh now.
Yeah, so do we offer the patient for sacrocolpopexy in case of ward prolapse?
No mesh. Mesh has been withdrawn.
Yeah, because we discussed these two options, sacrocolpopexy and sacrospinous fixation.
That is why I didn't mention about the mesh at all. Yes.
Yeah.
That was the reason.
Okay.
Yes. It has been withdrawn completely lately after 2021 or something. I will share that. I will search that screenshot, but I'm very
We
sure.
will not offer sacrocolpopexy.
No.
Okay, all right.
No. Okay. Yes, Dr. Shanti, this time you try another one. Is it okay?
No.
Good. Take your 2 minutes. You have 3 seconds. Okay, one more. 3 slides.
Yes,
This one.
next slide, ma'am.
Yes. Okay.
Yes, ma'am.
Yes, turn please. Yeah.
Hello, I'm Dr. Shanti, one of the doctor in the gynecology clinic today. Can I check your name and age, please?
Yes, I'm Elsie Jacob, 50-year-old.
So I can see from your case notes that you are suffering with some pain as well as some waterwork problems. Is that right?
Oh, yes. Actually, the pain is bothering me too much. I don't know why I'm having this pain all the time.
So can you elaborate your pain still more?
Oh, yes. Actually, what I have noticed that when I'm full, like my bladder is full, I feel a lot of pain. And after passing the urine, the pain subsides.
Okay, fine. If the pain is graded as 0 with no pain and 10 is given as the point with maximum pain, where do you want to put the pain as?
At times it is 8 to 9.
Oh my God. Yeah, we are here to help and support you. So, do you have other water problems? Like, do you leak during do you have to leak any problem with leaking of urine?
No,
So, do you have to rush to the toilet?
no,
And is there anything like any bowel problems? Like, so do you suffer from any other bowel problems as well?
no, no.
So, some personal questions. So, regarding your sexual life, so are you sexually active?
Yes, I am.
So, is this pain affecting your sexual life as well?
Mm, yes, yes. Actually, sometimes because of pain, I'm not able to have sex.
Oh, I'm very sorry. So, is the partner supportive?
Yes, here he's very understanding.
So, in the past, have you ever been suffered with sexually shared infections?
Mm, no, no.
So, you have been suffering for past 6 months. What are the tests as well as treatment tried?
I don't think so. Like I just off and on, I was taking antibiotics. That's all. Nothing else.
So, is that giving any relief for you?
No, no. And actually, a GP told me to bring some food diary and write down my food habits. So I've done that as well. I don't know
Yeah.
whether my condition is related to food. I don't know why he asked me to do that.
So, do you have so much pain when you take some spicy foods, like like
Kind,
spicy?
I can't
Yeah.
say. I don't remember. Yes, I think the pain increases. Yeah.
Okay. Yeah, I will explain the food diary later on.
Okay.
So, what about your periods? So,
Periods are they have become irregular. Maybe that is because of my age.
okay, fine. Are you up to date with your smears?
Yes, they're normal.
So, can you tell me about your previous deliveries as well as pregnancies?
Yes, I never had any problem. All my babies were born vaginally.
Very good. And what about any medical condition? Do you follow the GP for any other medical condition in the past,
Mm,
like diabetes?
no,
Okay. Any allergies?
no,
Any surgeries in the tummy or down below?
no,
Any family history of significance?
no.
So, some personal questions. Do you smoke?
I do, yes.
So, how many cigarettes per day?
Sometimes it is 8 to 10.
So, have you ever thought of quitting cigarettes?
Not really.
So, cigarette smoking is not good for your general health as well as for this condition. So, if
Okay.
you wish to quit smoking, I will put in touch with NHS Stop Smoking Services. How it sounds for you?
Okay, that's okay. That's fine.
Fine. Do you have habit of drinking alcohol, wine, and beer?
Yes, I do.
So those habits also can exaggerate these conditions like pain during waterworks.
Mm.
So I advise you to stop those also. If you want, I will put in touch with Stop Alcohol Services. Okay.
Right, yes.
So what about? Sorry to ask, any IV drug abuse?
IV drug abuse? No, no, nothing like that.
Okay. So whom do you live with?
With my partner?
Is he supportive?
Yes, he is.
Okay. What do you do for living?
Uh, I'm a lecturer.
Fine. And so in the past 4 weeks, have you ever been depressed or anxious for anything?
Mm, yes, actually, because of this condition, I feel low at times.
So I will put in touch with counselors as well if you wish, okay?
Mm-hmm. Right?
Uh, since you have pain for the past 6 months, I want to ask some personal questions. So, have you ever suffered with child sexual abuse or sexual abuse in the past?
No, never.
Okay, fine. So, I would like to examine you in the presence of chaplain to record your general health as well as to see the tummy, to look for the feel of tummy, and to see any masses or any hernias, and also to see the down below to see for the skin, the skin down below, how is it, as well as any mass or any hernias underneath. Is it okay for you?
Yes.
So, do you have any idea about what you're suffering with?
Okay, and GP also did my urine test. So is it okay? Is it normal?
Yeah, your urine test is been with you, with me, and I've checked your name as well as NHS number, and the urine is normal and it shows no bacteria, no evidence of infection is there.
Mhm.
And your food diary is with me. The food diary shows that the days when you take the spicy food, the pain is increased. Okay,
Yes.
and we call this condition. So do you have any idea about this condition?
No.
So we call this the suffering which we are doing, like so the pain which is relieved on on passing urine, we call it as bladder pain syndrome. Have you heard it before?
No.
So we have the water bag, and inside we have the protective layer. Okay, so at times what happens is this protective layer um, uh, um, is lost due to some reasons. Okay,
Mhm.
and what happens is the urine will go and irritate the nerve fibers underneath, and because of that only you are having this pain.
All right. Yes.
And it is a condition where the cause is not at all found, and so we have to try a different mode of treatment. And because of no cause is found, I'm very sorry to say there is no definitive treatment is available.
Mm-hmm. All right.
So your treatment will be by a group of doctors like my consultant, waterwork specialist, pain specialist, as well as counselors, and like pain team and the waterwork specialist. Okay.
Yes.
So first we'll start with the lifestyle measures. So the lifestyle measures start with. I've forgot your to ask about your height to weight ratio. Is it normal?
Yes, I think it is 24 or 25.
Okay,
Yeah.
fine. Yeah. So first we'll start with the lifestyle measures. Like we'll start with what is the that is the you are getting pain only on taking spicy food. So we make sure that we'll put in touch with a dietitian and make sure that what will be the diet suitable for you will be given by them. Okay. And we also ask you to take about 1,500 to 2,000 ml of water to drink so that your urine will not becomes more dilute or concentrated. And make sure that you don't drink plenty of liquids just before going to bed.
Mm-hmm.
And then we will give you some test as well, that we have to do some test as well, like urine test has come out as normal, but we will check whether the other bugs, like rare bugs like tuberculosis or chlamydia, are found in the urine, and we will treat accordingly. Okay.
Mm-hmm.
And then we will start with some yoga, meditation, as well as relaxation exercise. And then we will give you some painkillers, simple painkillers like paracetamol as well as ibuprofen. But you are already taking all those drugs, is that right?
Yes, these painkillers are not helping me. I'm taking paracetamol, but there is no improvement.
So in that case, we will put in touch with a specialized pain clinic. So where they will give you some what is that special physiotherapy exercise for the pelvic floor muscles, as well as massage therapy will be given to you.
Mm-hmm.
And then I will put in touch with the counselors. So those counselors will give a treatment called CBT. So cognitive behavioral therapy. They will teach you how to cope with these conditions. Okay.
Right.
And we put in touch with a support group also. So those are the people who are suffering with pain like this, and you can get and share more ideas of how they are getting treated. Okay.
Yes.
And With all these measures, it may take 6 months, and we will review you again with this bladder, the like food diary again, and see whether your condition has improved or not. If your condition has not improved, then we will do what is called we will put in touch with a specialist water doctors, so who may give you some higher tablets called the higher tablets which may release the happy hormones that may calm the bladder, as well as they will also give some other medications called cimetidine, which will block certain chemicals called histamine in the bladder. So with all these medications, most of the women will become all right. Okay.
Mm-hmm. Yes, yes.
So if you are not getting treated with these medical methods, then there will be an MDT discussion where the group of doctors like pain doctor, my consultant, as well as the water doctor will discuss what will be the good treatment for you, and the treatment will be informed to you as well. Okay.
Yes, time is up. Okay.
Yes. And what it involves is after that, the surgical treatment involves that is injecting certain chemicals called like numbing chemical like lignocaine will be injected inside your bladder, and certain chemicals like those deficient inner layer of the bladder will be given through water pipe, and these may calm the bladder as well. Okay.
Okay, close the station. Time is up. Yes. Okay.
So I will give the patient information leaflets, and I will write back to the GP, and I will put in touch with the support group as well as counselors. Okay.
Right. Yes, yes. Okay.
Yeah.
Thank you.
Yes.
Well done.
Okay. Yeah.
So bladder pain syndrome, diagnosis of exclusion. We know it is a like chronic pelvic pain for more than 6 months. So you asked about the child's sexual abuse history. You can ask, but is it necessary in this one? Because yes,
That
we
is the
need to exclude everything.
Yeah.
So green top guideline, they have they mentioned in the DD, we have to ask about child sexual abuse, chronic pelvic pain, and where we don't know the reason why she's having the pain. So I will see that.
Yes, ma'am.
Okay, right. So any one or two questions like that, it's not going to impact, have an effect on your information gathering. But if they find that it is an unnecessary question, so no, they will not deduct the marks. Even no, I don't think so. But I have to make sure that this child sexual abuse history is necessary in this station or not. Okay, because I have not mentioned. Okay, anyone has any comment on that? We know it is differential diagnosis. We like diagnosis of exclusion. Green Top guideline, they have mentioned ruling out malignancy, endometriosis, so many things. Just have a look. There is a paragraph inside the guideline that it is a diagnosis of exclusion. So just read whether they have mentioned to ask about the sexual abuse history in this station or not. Vaginismus, we know we are going to ask. Chronic pelvic pain, we know we are going to ask. So just see. Okay. Because she has the food diary and everything, and it is very clear that is this the bladder pain syndrome.
Yes.
Okay. All right. Hello, I'm Dr. Shanti, one of the doctors in the Urogynaecology clinic today. May I confirm your name and age, please? How may I address you? Thank you, Mrs. Jacob. I understand you have been referred by your GP because you're having pelvic pain and some problem with your waterworks, and you are here to discuss your test result as well. Am I right? Is there any other concern and expectation from today's meeting? So I will be addressing all your concerns. Before that, is it okay if I ask you a few questions to know more about your condition? Then discuss the test results and further management plan. I will be giving the written information leaflet and write back to the GP about our mutually agreed plan. Is that okay? Can you tell me more about your condition? Since when are you having this pain? Can you assess or score the severity of pain on a pain scale of 0 to 10, where 0 is no pain and 10 is severe pain? Is there anything that relieves the pain or worsens it? Is the pain relieved when you pee? Yes, it is. Have you taken any treatment? Paracetamol. So is it effective? No. Do you have to rush to toilet to pass urine? How many times do you have to go? Do you leak urine when you lift heavy weights or do exercise? Any change in the color of urine? Food? May I know about your food and drinking habits? I can see that you have brought this food diary, so I can see that you're taking more spicy food and more of tea, coffee, soda, and alcohol. So, does your pain increase when you're taking more spicy food? Have you noticed it? Is it affecting your quality of life? How are you coping? May I know when was the last periods and how are your periods otherwise? Any pain, any history of painful periods? Are you updated with the cervical screening? Have you been using any birth control method? Then ask about the sexual history, any problem during sex, any pain, abdominal vaginal discharge. Ask about the pregnancy and delivery, medical history, whether she has any medical condition, she's on any medication, any allergy, surgical history, occupation, partner and support, smoking. Yes, you have to offer her NHS stop smoking services, mental health history. She is feeling very low and down. So we can also put you in touch with our counselors. Is that okay? Thanks for these informations. Would you like to add anything important? I can see that your weight height ratio is 24.5. Am I right? And regarding I would like to examine you with your permission and in the presence of chaperone to assess your general health. I would like to examine your tummy and from down below to see if there is any local cause of pain. I have the test results and I have confirmed your name, date of birth, and NHS number. Do you have any idea about the result? The urine test is normal. It means that there is no infection in the urine. So if there is no infection in the urine, it means nothing is there. No chlamydia, nothing at all. So just keep it simple. No infection in the urine. And also, as I have mentioned, that uh, I can see you're taking more coffee, tea, and spicy food. And on these days, you have increased pain. And on other days, when you're not taking the spicy food or when you're not taking any coffee or tea, the pain is less. Am I right? So, from the information which I have gathered and from the test results and food diary, most likely you are having a condition known as bladder pain syndrome. Have you heard about it? So let me explain it to you. I can draw and explain. This is the bladder, the water bag. It stores urine. And in this, there is protective lining which protects the bladder tissue. In this condition, the protective layer is not present everywhere and it may be absent at some places and that area is exposed. And when this exposed raw area comes in contact with the urine, there is increased pain and pain is relieved when you pass urine and empty your bladder. Am I clear so far? Any questions? It is a lifelong condition, so there are treatments available which can improve your symptoms, but I'm sorry to say the condition may not be cured completely as the symptoms come and go in phases. So regarding the treatment options, we can offer you the simple measures, some simple painkillers, some other medications which can relieve your pain, and if that fails, then we can offer some injections in the bladder. There are some electrical devices which can be used. Surgery is done as a last resort. So is it okay if I discuss about these treatment options? So the simple measures include avoiding spicy food, cutting down on smoking, alcohol and caffeinated drinks. And for that, we would like to refer you to the dietitian. And you are taking the painkiller paracetamol. It is not effective. So we can offer you ibuprofen. Do some relaxation exercise and also doing the pelvic floor muscle exercise will help to improve your condition. And for that, we can refer you to the physiotherapist. Massaging the muscle of pelvic floor decreases the strain on bladder. Counselors, we have already told, no need to repeat. Also, we can put you in touch with the support groups. Also, I will be involving the waterworks specialist because it is a bladder condition. And after that, we will give you the follow-up appointment and maintain your bladder diary and food diary. And we will review you after a few weeks if to assess whether the condition has improved or not. Any questions? So, like in the follow-up appointment, if still you are having the pain, then we will offer another medication which releases the happy hormones, and this can help to improve your symptoms, but it can cause side effects like dry mouth, constipation, and weight gain. There is another medication which blocks the release of chemical called histamine in the body, that is cimetidine, but it is not licensed for use in this condition. However, we have seen that in many women, condition improves with these simple measures and with these medications. Any questions? If the condition does not improve, then your case will be discussed by a team of experts, including my consultant, water work specialist, counselors, physiotherapist, psychologist, pain specialist, and the specialist nurse. And you will be offered other treatment options, which are quite invasive, and they involve the surgery. So, would you like to know about those options? So here your time was over. And after that, whatever you will speak, you will not get any marks. So the good idea is that after talking about one treatment modality, simple measures, medications, now you know you have told her about all these simple measures. So before talking about the surgery in detail, just ask her, would you like to know about these options? Would you like me to
Okay.
explain more about these options? Yes. So in the
Okay.
exam, usually there is no time after because your history and everything is going to take
Okay.
5 minutes explaining the result. And when you are starting management, you get only 4 minutes in the exam. You don't get 6 minutes. Rarely you have 6 minutes because the role plays they talk a lot. So that is
Yes.
a very good idea because maybe surgical treatment doesn't carry marks in the exam. So just seek her permission. Just see what the role player is saying. If she says, okay, tell me in brief about these surgical treatments, right? So it means it carries marks. Now you're going to talk in brief only. Okay, so yes, then talk about, yes, there are some medications which can be injected inside the bladder with the help of thin tube to relieve the pain. And we can offer some local anesthetic to numb the area inside so that you don't feel pain. We can offer electrical devices for nerve stimulation to reduce your pain. You can avoid using the terms like neuromodulation, cystoscopy, and hydrodistension. She will not understand and it will consume you a few seconds. So just say, there is another option. We can offer a procedure in which telescope and camera will be inserted and sterile water will be instilled inside the bladder to relieve the pain. Surgery of the bladder is done as a last resort and it is done by experts at a higher center. Any questions? So can I use antibiotics for long term? So no. Here also, no, you will not be using the antibiotics. It is only given if the patient has urinary tract infection. Otherwise, no. Why? Because it can cause side effects and you can develop resistance to antibiotics. This is very nicely given in the new talk.
Yes.
Talk has actually nothing in that talk. It is all story. But
Yes,
yes, the talk is nothing. I read the talk. My God, there's nothing. Only they have mentioned about the Green Tab guideline has discussed this, the Green Top guideline has discussed that. The only a nice point which I got from the talk was that no long-term use of antibiotics in asymptomatic patients who is not having any urine infection because it can cause side effects and resistant to antibiotics. That's all. All right, and then end the station. I will be discussing your case with my consultant and arrange next appointment after a few weeks. We'll give you the support group number and contact number. So very important algorithm. So we did have to discuss about the first line treatment because initial assessment is history. Okay, assess the symptoms, pain, quality of life. This sexual abuse, I have to confirm. Other causes. This is what I wanted to say that here they have mentioned everything in the box, the differential diagnosis. You can see malignancy infection, overactive bladder, bladder calculi, bladder outlet obstruction, prolapse, endometriosis, radiation drug-related cystitis. They have not mentioned sexual abuse. Even in the guideline, they have not mentioned.
I saw the guideline, I think, ma'am. I just
Okay.
asked at that.
Just
Yeah.
quickly revise it. Even I will do the same. I will do the
Yes.
same. Yes, it is not that passing the exam makes you 100% perfect. No. Even I have
Yes.
to keep reading so that I can give the correct information. And any correct information from you people is also welcome. It is always a tool
Somewhere I
of
the tuberculosis and
yeah,
chlamydia, ma'am, in the guidelines. So I added that also. Yeah.
Okay, fine. All right.
Yes.
All right. So I'll just also go through it and I will send some screenshots whether it is yes or no. If it is yes, okay, I I agree. Fine. And then second line treatment, again the medications. And if treatment fails, then MDT, pain team, and clinical psychologist. Okay, third line treatments on, no time in the exam, but you have to know about them. Few lines, you have to know about them. That's all for today. Okay, any questions? Any more questions? Done. Okay, so we are done with the today's session. All right, so next, what was it? Postpartum? I think so. So whatever
Postpartum.
you shared, all right. So just be ready with that. Thursday, coming Thursday, same time. Okay, thank you. Good night, all of you. And keep studying. How many days left? 1 month. Those who are having exam in the first week of November, it's not even 1 month because exam is in the first week and the second week of November. So all the best and keep studying. Stay focused, fully focused. Okay. And Thursday, any major festival is there? Anything? No. No. If any major festival, anything, just
Done,
please
ma'am.
inform
Yeah.
me, huh?
Navaratri is going on for us. Yeah.
Yes, that I know. My friends told me it is going on, and then they told me Saturday, Sunday they have all
Yeah.
those.
Puja. Yeah.
Yes, exactly. That Durga Puja is going on. Yes. I know I have very nice friends, so that is why I was asking that any
So
festival
we
I
can do that. We
Mhm.
can do that on Thursday.
Yeah, that's
Yes.
better, I think, so that you will be free
Yes.
on your festival.
Yes.
Exactly. Yes. So what a coincidence. No,
Thank you.
yeah. Thursday is
Yeah.
okay, as scheduled. All right. Good night, all of you. Take care and bye-bye.